Yeah. And, we think about, aging at home as whatever home is to us. And it's not always a single family home. It's not always the home that you raise your kids in. It is the home that you choose to live in, and having better options in the market just can make the choice easier.
Hello, lovely listeners. Welcome to Thrive in Your Space, the podcast where we demystify the planning so we can enjoy our best lives as we age. Each week, we feature a new guest who discusses incredible ideas for thriving in your space and in your life. And remember, it's not only about finances and houses, it is about thriving. Welcome our host, Erin Griffin, who as always gets into the nitty-gritty of life to help you thrive. Stay tuned. This episode promises to be amazing.
My name's Erin Griffin, and welcome to the Thrive in Your Space podcast. I am so excited to have our guest, Bonny Slater, who is an architect with Gensler. And she is just working on some amazing projects and has in the past focusing on aging in place. And I am so excited to hear what you're doing. Thank you for joining us, Bonny.
Pleasure to be here.
So I guess we can kind of jump right in if you're willing and ready to go.
Yeah, let's go for it.
All right. I guess just start with telling us a little bit about yourself, how long you've been an architect, how long you've been at Gensler, kind of give us a little background.
Well, I'm actually not an architect.
Oh, sorry.
So I work in the world of architecture, but my background is in interior design and psychology. So my focus is on the inside of the buildings.
Can I stop? I'm going to break. Let me do that over because I'd rather say exactly what you are if you're okay with that. I'm sorry. I just assumed you were an architect.
No, it's fine. I mean, it's kind of an architecture firm, but you could also just say I'm a design director because that's my
design director title. Okay.
Yeah.
And then you can expand from there. Let's do that. Yeah. I'm sorry about that. But let's, they can edit all this out and then we'll start over. Okay, I'll just start from here, and I will call you a design director. And correct me if I'm wrong, Gensler is actually the largest architecture firm in the world?
It's the largest design firm in the world. So architecture, interior design, brand, product. We don't have in-house engineering, so that's why we're the largest design-only firm.
Got it. Makes sense. Okay, cool. I will say that too. Awesome. I will start this over. I think I can even cut out these minutes and then send it. Okay, let's go from here. Hi, my name is Erin Griffin, and I am the host of your Thrive in Space podcast. And today I am so excited to have Bonny Slater, who is a design director with Gensler. And she really focuses on a lot of what we're so passionate about, especially with aging in place and the housing shortage. So without further ado, welcome, Bonny. Thanks for joining us.
Yeah, pleasure to be here.
All right. So I think we just kind of dive right in and just why don't you tell us a little bit about yourself?
Sure. So I am an interior designer by trade, and I also have a degree in psychology. So I really came out of school thinking about the people that inhabit buildings and how to make their lives better, and really saw design as a tool. And I was drawn to healthcare initially because I saw where design really could have an impact. We all know how badly healthcare needs it. And there was a real interest in the industry at the time for evidence-based design. So connecting the psychology piece to the design piece. So I have practiced healthcare design for about 20 years now, 10 of those with Gensler. And now I'm one of the global practice leaders for our healthcare practice. And I've focused on not just healthcare as in hospitals and that kind of thing, but the broadest sense of health and wellness. So everything from, healthcare at home as a future piece to, community wellness centers. So really looking at how do we keep ourselves healthy and out of the healthcare system to how can we take care of ourselves outside of the hospital and within the hospital. Right now I'm thinking a lot about what is the future of healthcare and how COVID really changed what we thought was possible and how quickly we thought the future might get here. And it's exciting to see what future capabilities we might have in our homes.
Yeah. What have you thought about? What have been some prevailing key points to that? I'd love to hear.
Yeah, well, it's really interesting if you think about the history of healthcare and that it was done in our homes for most of history. And it was only since, maybe the mid 1900s that everything moved into an institution, for better or worse.
Right.
Some outcomes improved, some not so much. And now we really see a shift back to doing that, and where it's not just about efficiency from the doctor's point of view, but what can really drive positive outcomes from a patient perspective. We talk about just going into the hospital can be the greatest risk of death. You could get an infection just going into the hospital. And as we age, that becomes more and more of a concern. Or, you think about during COVID, the fact that, well, that was a huge risk for older adults. Or, for pregnant women, births did not used to happen in hospitals. And all of a sudden, that's where most of them happen in the United States. And when you're in a situation where the hospital is full of sick people, giving birth you're not sick, you're just having a baby. So how can we look at the way things used to happen alongside of the technological advancements that now enable a lot of what happens in a hospital today as an inpatient acute setting to take place in the home through remote monitoring? I mean, that's the futuristic piece.
I love it. That's amazing. And it touches on everything, even a little bit about what's in the book, is keeping people connected, whether it's monitoring your health, having seniors be able to hit just a button to call their kids while they make dinner, just that connection, that feeling of being safe and in your own home, regardless of the situation. I love that. I just think that's amazing. So how do you get inspired in the creation of aging in place, like of their spaces, of the design? What do you find inspiring?
Well, being at Gensler is a great source of inspiration because we have so many different practice areas of expertise. We have a residential practice area. We have a senior living practice area. And they really focus on these specific aspects of where you live, where I'm coming from more the health side, that it's been really great to collaborate and see what's possible if we put our minds together. We realized we work with a lot of developers who design multifamily buildings for intergenerational, for just market rate, and for senior living. And we realized they're not really thinking about healthcare moving into the home.
Interesting.
It's just not in their menu of market needs. And we think it should be, right?
Absolutely. It's going to be one of the biggest populations that we're facing with the housing shortage. I mean, this should be, and of course, developers, it is a bottom line thinking a lot of the time, but this will actually accentuate it. Think about the marketing potentials and just the demand that can go into those kind of places too. It's huge.
Yeah. Yeah. And, we think about, aging at home as whatever home is to us. And it's not always a single family home. It's not always the home that you raise your kids in. It is the home that you choose to live in, and having better options in the market just can make the choice easier.
Absolutely. Absolutely. And it is one of the most stressful times when personally, this came from a place of me going through it and seeing our parents or our in-laws go through this, and the stress, even if you think you're well prepared, you can't be. And we trying to leave that home and this was our situation, was a family home, is so stressful on top of health issues and things like that. So it's a big deal. It's a big deal. And I think all of us personally, if you asked us, would you say, I'd love to live in a assisted living, or would you rather say, I'd love to stay in my home, right? It's a no-brainer really on that. And not to mention the cost, right? Okay, so let's go to, I don't know, how can you demystify the aging in place? We talk about design, we talk about different spaces for different people, and that is a very unique focal point. But can you give us a little more on that?
Sure. So at the most basic level, it's the ability to stay in your home as you age and your abilities change. So this could mean staying in the home you've lived in for a long time and making some physical modifications, just to make it a little bit safer and easier to get around. It could also mean choosing a new home to become your home later in life. And this could be a regular market home that's maybe single level, has a few less steps, and maybe a smaller yard to care for. It could also mean, moving into a multifamily house where you have no yard.
Mm-hmm.
It could also mean you're choosing to move into a planned community for older adults. And, I think that's a very personal choice,
Yes.
but that can be part of your aging in place plan, choosing an independent living solution where, in the case that you do need a little bit more help, there may be services you can tap into, that you kind of know what you're getting into from the outset.
Yeah, perfect. And I think it's different if it's a person's choice to go into that, especially the sense of community that does exist in places like that is amazing, because that's part of thriving in your space, right? Mentally as well as physically. And if it's a choice, I think the facilities offer amazing options for people to have that sense of community, for sure. I mean, it's fun. I had fun there. They play games. There's a lot of social activity involved as well, and care. And it's a great option for people. And then another thing that we're seeing on this side, I don't know, we're West Coast a little bit more. The ADUs, the assisted, or the dwellings that you can do,
Yeah.
we can actually lend on those now. They're actually a real legit lending product, because then at least you're separate, but you're not. You still have your own home, but the kids can be right there with the mom or dad or both, and they still can feel independent. So that's kind of a fun phase too.
Yeah, and we're seeing a lot more jurisdictions allow that.
Cool.
It's been a recent change where not all jurisdictions would permit that, but I think most have caught up. I think in DC, that was a fairly recent change where I'm based.
Yeah.
The other piece is developers of single family homes have, for a while had in-law suites, where they're large enough houses to have them. But,
exactly.
It's an interesting prototype because it's not necessarily for your in-laws. It can be for an au pair or a nanny when you're younger. It could be for your parents when you're older.
Mm-hmm.
It could be for your kids who don't move out until they're in their 40s. So,
oh gosh. Which is happening because this crazy economy, right? The kids are staying longer, so that's a good point to make.
Or you can have all of those at once.
Oh no.
I like to see design solutions that can be flexible depending on where you are in your stage of life.
That's smart. I think that's a great idea. And I love that forethought. I think that's really what we're lacking in design and building right now is long-term thinking, right? And I love that you're focused in that space, and every bit helps. And I think more people are becoming aware of this need that is really going to come crashing on us if we don't keep up. It's going to be a really problem, especially when all the kids realize they've got like a spare bedroom for their parents all of a sudden, that's all they got, right? Without thinking about the future. And that's a hard part for me and my job, because you don't really want to think about those things in life necessarily. It's you want to be present, you want to enjoy life, but a little bit of planning can go so far in that longevity, just happiness and just thriving again in your own space, whatever that means. So that's awesome. I love that. What trends do you see emerging in the field of aging in place?
So, and I'm going to speak more from a commercial perspective, just because that's my world.
Absolutely.
One of the big trends we're seeing is more urban multifamily housing that's designed for independent senior living. So this is not the sprawling on the edge of suburbia where land is cheap and you're kind of isolated. This is your downtown. It's a high amenity kind of building, but it's just for 55 plus.
Yeah, yeah. We have a lot of that in Chicago. There's a couple great buildings right on Lakeshore Drive that are focused only on that. They're pretty beautiful buildings, and people love it.
And people want a sense of community, and that creates that. You don't have to worry about all, kids jumping in the pool at all hours. I mean, I'm sure there's grandkid time, but
Right, exactly. Who knows? Maybe they're not allowed. No, I'm sure there's visiting hours for the kiddos.
Yeah, I'm sure it's limited, right?
Yeah, yeah.
And we're also seeing a shift from, just thinking of aging in place to thinking of more inclusive from a multi-generational perspective in terms of individual housing solutions. So think about, you're a new parent and the baby proofing that you need to do in a house to make it safe for a young child.
Absolutely.
Or think about you broke your leg and are going to have some mobility challenges for a couple of months. Or, a family member is ill and needs a wheelchair or needs a full-time caregiver. We don't just need ease of accessibility when we get older. We need it throughout our life. So thinking about it in terms of designing for inclusivity and for resilience in our life as more of a strategy overall. And that's what we're trying to help, developers give tools for selling this because it is a marketable attribute.
Absolutely. How are they reacting? How are the developers going, easily, or are they kind of like, whoa, what are you doing?
Well, it's a tough time for developers overall. And so anything that is riskier and not tested and true is more challenging, but it's just about finding the right mix and the right partners in the right market.
Yeah, makes sense. And every market is so different too. You're right. And times are right now more challenging than they have been, but like every cycle, they are going to cycle through. And I think as we cycle through, we're going to see a lot more of this. Do you agree?
Absolutely. A couple just details I would say is, bathrooms are the new kitchen, in residential real estate, they talk about that. And this is a real opportunity where you can make a really luxurious bathroom that is more accessible. We don't need a bathtub in every room. It can be a spa shower. And so it can be something that's much more accessible, but also it is it can be an indulgent thing, so you don't have to break your budget on making something more accessible and have it look like an institutional room, right?
Absolutely. Well, and even just basic stuff. Like if you look at, say, the safety handbars, there's really gorgeous handbars. You don't have to get those just steel-looking hospital-like bars that we see. It's changing the whole narrative of design and how modern and amazing it can actually look and be accessible and safe. And again, that forethought is huge. I wish, some of my family members and friends and their parents, if we only knew this, in that remodel when the empty nesters are like, all right, kids are out, let's remodel the home. And then they spend money. And then all of a sudden you're like, oh no, now we have to spend more money doing more design because we didn't think about that long-term factor. Especially if people are staying in place, due to funds, due to lack of inventory right now. That's a thing. There's not a lot of smaller homes anymore because people aren't really upgrading right now either. So we're not, people that want to buy their first or downsize are kind of all in this homeostasis right now where nothing's really happening.
Everyone's stuck.
Everybody's stuck. Not for long. We're going to keep plowing through. We hope so, right? We hope so.
Yeah.
Okay. Let's see. How do you balance the aesthetics and the functionality? We talked a little bit about it, just the safety bars. Any other ideas?
Yeah, well, I think this is really the role of an interior designer, and where by tapping into a professional, this is what we do all day long, right? Is we find the things that are beautiful and also check all the boxes on functionality, right?
Perfect.
But you have to understand the functional properties that you're needing to hit, whether it's slip resistance, to minimize falls, or if it's falls are a concern, maybe it's a more cushioned flooring. Maybe it's the quality of lighting and the contrast between surfaces to make visibility easier. Maybe it's the acoustics in the space to make things easier to hear.
Oh, smart. Yeah, I didn't even think about that part of it. Or even something as simple as paint, right? For different, aging eyes. There's a whole senior paint line now. I mean, there's such neat nuances.
Yeah, and then you get your cataracts taken out, and colors all look differently, as my stepfather experienced.
Oh, no.
He's like, oh.
Was it a good change or a bad change?
It was a good change, but it's still a change.
Right.
Yeah.
Awesome. Oh, I love it. All right. So I guess sticking with that, let's talk. Do you have a favorite project or a fun example you want to tell us about where you really thought, wow, I just nailed it?
I think that's a hard one. I'll tell you where I don't think we've nailed it as an industry yet.
All right, even better.
So think of all of the equipment that we end up accruing as our mobility might change. You might need a special chair, some assistance, using the toilet, even wheelchairs. You might have a piece of any kind of medical equipment. Any durable medical equipment out there is ugly. And there is no beautiful version, right? So I think this is the biggest opportunity for product designers to start designing products that can be beautiful and functional beyond just, finishes. We can find the right finishes in the space, but it's the furnishings and equipment that we need more help with. And Gensler actually got into designing grab bars because we saw that need. And so, we have lots of those beautiful grab bars that we've designed, I think, through with a partner. I'll give you some comments for your notes. But
yeah, please do. That'd be amazing. We can share that too, because we're happy to share the resources for sure. That's what this is all about. This whole Thrive Network is really about meeting people like you, who are just in it with their heart, ethically trying to really change things. And I really want the resources to come together for anybody from the beginning stages of thinking about it as kids, about their parents, or throughout the whole phase of life. So any resources you can offer us in our network is absolutely perfect. Awesome. Well, how about, we talked a little bit about connecting and staying connecting. What are some of maybe I'm going to actually phase this into two parts, because the first part that really intrigued me were acoustics that you talked about. And I'd love to hear a little bit more about the acoustics, what you do to enhance that for people. And then the second part would be, does that include smart technology, or what are some of your favorite smart technology advances to help the golden years go smooth?
Well, I think the most basic thing that we can do in our homes is use of furnishings or even artwork. So I see what looks like a fabric or, textile piece of artwork on the wall, right? So textiles can help absorb sound. So when we have upholstered furniture or upholstered walls, upholstered headboard, all of those things can help absorb sound. And in our home, frankly, it's not usually the biggest issue unless we're having a party. It's usually in the social situations where there's multiple people talking. Think of going to a restaurant with an older family member. I know how that's so challenging because the music is usually blaring and you just can't hear each other very well.
Very true.
But in your home, it's going to be really important if you're needing to hear instructions. If, let's say, you're doing a telehealth appointment. And if you're in a space that's maybe very reflective, like the room I'm in only has one upholstered wall, so it helps a little bit, but there's still a little bit of reflection. And if you can't hear your provider very well, you may misinterpret what they're saying. So in physical healthcare spaces, we're actually required to design to certain acoustical standards to ensure that you can hear somebody.
Wow. Oh, wow. That's great.
But we don't have the same standards for your home.
No, not yet, right?
Not yet. But, it goes to the point where textiles and those soft things do actually sort of function in absorbing extra sound.
I love that. And then as far as the smart home technology part, what do you see is, I get it. We've all experienced trying to help our parents or somebody that's not tech savvy try to work their phone or work their laptop or their pad, right? So the technology is not symbiotic with aging, right? As of now. But there are things that we can do, and there's simpler ways to go about it. Have you seen any progress there that you like?
Well, I love the robot potential. The companion robots, the robots that will play games with you, that will remind you to take your pills and help make sure that you've done that. There's so many different niche technologies out there around, like taking your pills or, falls or different kinds of remote monitoring. I'd love to see things that are a bit more integrated with each other, frankly.
Yes.
I think that's the opportunity to integrate your health data monitoring with your safety monitoring, with, just your family's ability to check in, with your ability to communicate with your family. I mean, I know it's hard enough for me to manage all the technology, different devices I have.
Right.
It's just impossible to then manage it for somebody else.
Very true.
Very true. The batteries or whatever recharge.
I know there's a lot. There is. And I love that idea. I mean, even though, unfortunately, I think healthcare is really far behind in the tech. I mean, even my charts isn't even a universal. It has to go per hospital. So, I have 2 different places. I have 2 different my charts. Something so simple that should be integrated isn't yet.
And you have a family and they all have multiple providers, multiple logins, and they expect you to manage it all.
Yeah, it's insane. It is. That is definitely something that might be out of you and I's realm of, improving healthcare tech per se, but hopefully there are other people, and maybe that'll be a next podcast. We find someone that works on the tech side. We have to make that a little interesting though. Do you see any mainstream robotics happening yet, or is that still pretty far off and expensive?
They're still pretty specialized. I know in Japan, the companion robots are, I've seen some stories around it there. They're not there yet, but they'll be there soon.
Right? I like it. I love that. Yeah, I think it's brilliant. I mean, I know there's a lot of people that think that's the end of a human race is robotics and AI, but if it's done responsibly and ethically, it can really elevate our existence at any level, regardless of age.
I mean, they're single function right now. Like they're transporting food to rooms, or they're transporting supplies in supply tunnels, or, hey, we have drones that are delivering prescriptions to your home.
True.
So there's a lot of interesting pilots that are single use. But I can't wait till we have the companion robots as a real extension of the family to help our elders, our family elders, or ourselves,
Right. Well, like you said, even if you hurt your leg, right? Or as a mom, can you imagine having a little extra help around the house like that? It's like the Jetsons. I'm dating myself, but I always wanted to be on the Jetsons because of that futuristic idea and the help with the robots.
I mean, I think a lot of them are being developed right now, more focused on addressing loneliness. So
I love that.
They're more of a social companion than somebody's like Rosie that's going to do your housework, right?
I love that you know that.
A little bit fun. I'd love one that has it all in.
Yeah, right. Well, hopefully, maybe not quite in our lifetime, but maybe the kiddos, right? Well, it's all fun to talk about.
In our 80s, we may have one.
I love it. I love it. That would be amazing. Because that's like 80 years off for me. Awesome. Well, I mean, we're kind of getting to the end of the podcast. Do you have any last tidbits you'd like to say?
Well, I think one of the biggest challenges that we don't always talk about in this conversation is how important basic infrastructure like having internet is to being able to live independently. And a lot of our country doesn't even have that yet.
That's true.
So, and if we are wanting to live in our homes where we do need more physical care and more medical care, we're probably going to need more reliable power as well.
Yeah, well, that's for everything, right? I mean, look at the way we're going with the grid and how it's failing us already with all the electric cars and lack of infrastructure. It makes sense even just in homes. And I don't know if you've worked on lower income projects at all, but that's a big thing too, is focusing on creating beautiful space in lower income housing as well. Everybody deserves a safe space to live. They really do.
Yeah. And it's just so focused on the urban areas that it's our more rural areas that are really being left out of the conversation here. So
makes sense. Yeah.
I think we should have the option to age in place wherever we are.
I love that. I can't thank you enough for taking the time. I know how busy you are, and it's been very enlightening talking to you, and I can't wait to hear about your future projects. This is going to be fun to hear of all the progress we do in the coming years and decades for sure. So thank you again for joining us.
It's been a fun conversation.
Absolutely. And we'll have you back on. I love kind of bringing people back through in 6 months to a year. And here, if you can always email and say, I have something fun I want to talk about, and we will. So it's kind of a never ending thing. Hopefully we'll reach a lot of people this way and improve some lives.
Yeah.
All right. Thank you.
Thank you for the work you're doing, Erin.
Oh, I'm trying. We all are, right?
Thank you for listening to Thrive in Your Space with your host, Erin Griffin. You've taken another step towards a life filled with joy and financial security. Continue learning fantastic ways to thrive with us by subscribing to our podcast and becoming part of our thriving community.